Welcome to another episode of Sitting with Shay. Today, I am thrilled to be joined by Dr. Valerie Ginsburg, owner of Optimal Women's Health, a compassionate women's health specialist right here in Denver, Colorado. She has a focus on patient education and personalized care. Dr. Ginsburg's dedication to empowering women is truly empowering because she wants us to take control of our health journey. Dr. Ginsburg, welcome. We're so excited to have you here today.
Thanks so much. I'm happy to be here.
Thank you. So with your dedication to really enhancing women's lives through this whole healthcare thing, I think it's absolutely commendable. And I want to know what started you on this journey, what led you to be an advocate for women's health?
When you're in medical school, you have to do a lot of different rotations, internal medicine, pediatrics, surgery, talking to women was just the thing that really got to me. All ages of women, and helping them to make good decisions for their own well-being.
That makes sense. I think I'm enjoying Women's National Month because I love talking to women. So I really understand that right there. When we think about the stages in women's life and the ages, I always want to know at what age or stage do you recommend that we come and see an OBGYN? And then why is that recommendation as such?
So young women can typically be cared for by their pediatrician up until the age of 21. That's when we recommend that young women start having preventative health care with a gynecologist. Before that, it's typically talking about contraception and STD testing if young women are having problems with their periods, things like that. But we start doing pap smears, which is screening for cervical cancer, at 21 years old. Okay. The reason that we don't do it before that is because we know that a lot of women who are exposed to the HPV virus, which is what causes abnormal pap smears and subsequently cervical cancer, the changes will go away on their own. And so we don't screen before 21 years old.
Wow, I'm going to learn a lot today, I can already tell. Now, with that, I want to know if you can share maybe some common misconceptions or some myths that women come in your office and you encounter these myths and then you have to maybe get them on the right track along the way.
Sure. Well, one of the myths, speaking of pap smears, is that we do pap smears every year. We don't do that. We haven't done that for a long time. Yes, between 21 and 30, we do pap smears every 2 to 3 years. And then for women who are 30 and over, we do testing actually specifically for the high-risk kinds of the HPV virus. And then if it's negative, it's really every 4 to 5 years as a recommendation by the American College of OBGYN. The other thing that I frequently have patients asking about is what, if anything, they should use to clean out their vagina.
It's a great question.
And
the
the answer is nothing. The way we describe it as gynecologists is that the vagina is a self-cleaning organism. It cleans itself out. There are bacteria that live in the vagina that we want to be in there that keep the tissue very healthy.
Yes.
And putting soaps and fluids and steam and other things in there just washes out all the good bacteria.
I'm actually floored right now because I think somebody at home is saying, what? None of these things? Because, we're really in this space right now where the internet is a sensation. And so they're offering us so many things. Let's do a yoni steam and let's use a new douche product and all these things. And you're telling us those are not good ideas.
It is not a good idea. The vagina cleans itself out. The only thing that should go in the vagina, I tell my patients, is intercourse and period products, tampons, cups, things like that. Other than that, no soaps, no oils, no steam. There is absolutely no reason to steam clean your vagina. It doesn't need sun exposure. The other, sort of myths that are out there are mostly on the internet.
Wow, this is informative. As a health specialist, are there some preventative measures or maybe lifestyle changes that women should implement to really make sure that we're having our optimal health throughout different stages of our lives?
Well, diet and exercise are a huge part of it. You want to maintain a healthy weight. You certainly don't want to smoke. And then exercise is really, really good. Exercise is really good for our brains, for our mental well-being. It's good for women's bones. We're at risk for developing, severe bone loss as we age. And it's good for our hearts.
Wow, I like that. So as we look at this, I know a common conversation that comes up is our reproductive health. And often it's really a topic of concern. And when we look at that, can you discuss the importance of regular screenings and checkups? And is there anything particular women should be getting checked when they're concerned about the reproductive lifestyle?
The main things in terms of reproduction are whether women are ovulating regularly. If you're having a period every month, you're ovulating regularly, which is extremely important for reproductive health. And then exposure to STDs, long-term untreated STDs such as chlamydia and gonorrhea can cause significant problems with blocking the fallopian tubes, which is also another cause of reproductive issues.
That makes sense. Now, I know we've been really looking at women at different stages, and one thing I hear a lot is about hormonal imbalances, and this being really significant in impacting women, impacting their health and their well-being. Are there some signs or symptoms that women should be aware of, or even approaches when you look at hormonal management and what that looks like?
So the main thing actually is if you're having a period every month, if you're not using contraception, hormonal contraception, and you're having a period every month, then your hormones are relatively well balanced. That's not to say that women don't have other symptoms of things such as acne and hair growth and weight gain that all can be associated with something that we call polycystic ovarian syndrome or PCOS. But as long as you're having a period every month, your ovarian hormones are working well enough that that should not cause problems with fertility.
I love that, and I think I have a side question with that, and you keep saying having a period every month. Does it matter if your period's at the same time every month or just that you're having it?
So the way we describe periods is from the first day of one cycle to the first day of the next cycle. Okay. And so it doesn't really matter how long you bleed, how heavy it is, how severe the cramps are, anything like that. We just want women to really be careful about documenting the first day of their period each month. And anything between about 25 and 40-ish days from the first day of one period to the first day of the next period is considered normal, and that you're ovulating on a somewhat regular basis, and probably not enough to cause fertility problems.
So I feel like I'm on the right track because I have an ovulation calendar.
Yep.
Might be too TMI for you audience, but I have some questions about practical advice and maybe tangible tips. Can you offer a way, I know we've been talking about health and wellness is a big part of it, but is there something that we should be implementing in our daily lifestyle besides health and wellness, that a vitamin or something that we should be doing to just
I'm glad
have
you
a
asked
better
that.
approach?
Yeah, the main thing that is important for reproductive health is folic acid. We know that folic acid is really important at helping prevent birth defects, and the most important time to have it in your system is before you know you're pregnant. And so we recommend that all women who have sex with men take something with folic acid every day. The easiest way to do it is just with a generic one-a-day multivitamin. All women's multivitamins have folate or folic acid in them, and I tell women not to spend extra money buying some expensive vitamin, not to pay extra for packaging, because you just need one a day for the vast majority of women that don't have any other problems.
Right.
Most women just need one multivitamin or prenatal vitamin a day. And you want to be doing it before you know you're pregnant. By the time you have a positive pregnancy test, it's kind of too late because the neural system has developed.
This is preventative before we get to those spaces. In your patients, I really feel like it's a big deal to make sure you're a part of their health journey. Now, how do you think that providers should really make sure they're giving the approaches where every woman feels like she's empowered to actively make decisions and actively be a part of her regular well-being? What should that look like when you're looking at providers, visiting providers? What should we be looking for?
Well, one of the important things that I've learned over my career is to sort of go through my questions and go through my recommendations. And then at the end of really every visit, I say, what questions do you have? Have I answered your questions? Because, sometimes women get distracted or they forget to ask questions that they have come in with. After this long of a career, I feel like I'm pretty good at anticipating a lot of the questions that women have and sort of covering things that maybe they hadn't even thought of. But frequently women come in with questions, and so I always try to allow space for that at the end of the visit to say, is there anything I didn't cover? Do you have any other questions for me?
Yes. So women, get your questions together. Go in with your questions. Be ready.
Yeah.
Be engaged, a part of this process. Regarding that, Dr. Ginsburg, when you really consider the importance of proactive healthcare, which you've talked about, what steps would you recommend women take to advocate for their own health needs and to ensure that they really get the best care? And I think we alluded to that a little bit, but how can we advocate? Because some of the times I don't think we properly know how to advocate for ourselves.
So I think it is a matter of documenting questions for yourself, whether they're in your phone or on a notepad or something like that. The other important part of it is that you have to, as a patient, decide how much you're going to respect or honor what your provider has to say versus what you read on the internet or someone in your family or a friend or some stranger in the grocery line tells you. And then you have to decide how you feel about all of that different information. I mean, we're not the police.
Right.
And so I feel strongly that what I can do is provide my expert opinion based on science and data and facts, and sometimes people don't like it, and that's their prerogative to look for other answers, but you need to feel comfortable with the person that you have chosen to be your provider.
Yeah. No, that makes so much sense because now we're all Google doctors.
Right.
So I come in with my own diagnosis, like, well, I think I have, and I'm going to believe me, but I think that's so important to really find what you're comfortable believing and who you're comfortable believing to make educated choices.
Right.
Oh my God, Dr. Ginsburg, thank you so much. You have shared so much valuable insight, and I'm excited for someone at home. I hope that you have been enlightened by this conversation. Dr. Ginsburg, is there anything else you want to leave our audience with or tell us that we should be aware of that maybe we didn't cover?
I think taking control of your own health and really making sure that you are making good choices is the most important thing.
Yes. I love that. I want to extend my deepest gratitude for your invaluable insight and your dedication to women's health. Now, remember out there, your journey in health, it is a partnership. So you should make sure you have the right supports and the right guide every step of the way. Thank you guys for joining another episode of Sitting with Shay, where we explore impact and we inspire change. Stay tuned for more conversations that uplift, empower, and celebrate remarkable individuals. Stay healthy and stay empowered. Until next time.